Good morning, participants. Before I welcome all the participants, I request all of you to mute your audio. So I welcome you all for our webinar on behalf of Defense and Strategic Studies, Udis College, Vellore. On my own behalf, I invite Dr. Jacob John, renowned virologist, for our second webinar series on COVID-19. Last week, it's an overwhelming response. We received many questions, so that we planned this week to answer all those questions. I thank Dr. Jacob John for accepting to be here with us today. I invite all our staff members, friends, renowned doctors, journalists to present with us today. So when we want to name this topic, Dr. JJ said it can be COVID conundrum. So I thought, go and browse what is the conundrum is all about. It said that it's a very difficult and impossible question to answer. I agree it's a difficult question on COVID-19, but I'm not thinking it's impossible. With doctors and eminent doctors around us, I think we can answer all this COVID-19 and stop COVID-19 too. We know we have a history. In the past, it started in Vellore Polio Plus program. It started by none other than our own Dr. JJ in Vellore, and he showed to the world that we can eradicate polio. Rotary International take pride in saying that only service organization which eradicated a deadly disease like polio is none other than Rotary International, but for the seed is sown by none other than our JJ in Vellore. So in the same way, we thought, why not we take up this COVID-19, and with the doctor's advice and plan, we can take forward and see that COVID at least start to control from Vellore, and the same thing pass it to all over the world. So with this, I stop here and invite all the participants to be with us today. Yes, doctor. It's mic is on to you. Doctor, you are not audible. You are not audible, doctor. You have to unmute yourself. Is it okay, doctor? Yeah. Okay, you can unmute your audio, doctor. All right. Can I unmute you, doctor?
Yes.
Yes, doctor.
Am I audible now?
Yes, doctor.
Just
Sure.
now I'm audible.
Yeah.
Am I audible?
Yes, doctor.
Yes.
Go ahead.
You can hear me?
Yes, doctor.
Okay. Now, I use the Oxford Dictionary, in which the definition of conundrum is a difficult or confusing problem, not impossible. It's a confusing problem. That's why I chose the word conundrum. Now, last week we had a long discussion about the problem and what is now difficult or confusing. Went through a long lockdown, which is being eased from 17th of this month. When we started on the 25th of March, the number of infections reported was a little above 500, 540 or so. But then lockdown is being eased on the 17th of May, the number is about 1 lakh. So it is really confusing as to why the lockdown, what happened, and did we not achieve the expected result? So that is one side of the issue. Let me first answer the questions that have come to me, and then I'll get back to the conundrum. Am I visible on the screen?
Yes.
Am I audible also?
Yes.
All right. Everybody can hear me?
Yes.
Yes, doctor, you're audible to everyone. Doctor? Doctor, you have to unmute yourself, doctor. Your audio is muted. Sir, your audio is muted.
How about now?
Yeah, fine, fine. Now,
Okay.
go ahead, doctor.
But the full screen is not coming.
Doctor, here is coming,
Dr.Raj's
doctor.
name is on the screen.
Doctor, for me it's coming, doctor. For
Name
me
is
it's
on the
coming.
screen.
Yeah. For me, you are in the full screen. Go ahead, doctor.
All right. So
Yeah.
some of the questions that I received, I will answer them first and then move on. Will any Indian medicine work? The answer is most likely not, because Indian medicines are not directed against viruses. Indian medicines are mostly directed against your body's own responses, body's own tissues, because the philosophy of Indian therapeutics is that disease is due to imbalance within the body. Microbial causation of diseases is not a accepted theory in Indian medicine. Therefore, I don't think that Indian medicines will work in this condition. Someone has asked me about will the disease recur will happen again. The answer is, for the vast majority of people, which I would say is 99.99%, no, the disease will not recur. The recurrence that people are talking about is not about disease, but about infection detected by the PCR technique. That is, after you get 1 or 2 negative tests, the next test becomes positive. That is the issue of the recurrence. I don't think that is recurrent infection. It is persistent infection. And you know that the PCR has not 100% accuracy. If you take a throat swab for PCR, it is about 1/3 of the time it gives you correct answer. If you take nasopharyngeal swab, you get about 60% of the time the right answer. So in general, its sensitivity is 50%. So if you missed once, it doesn't mean that it was a clean certification. So occurrence by seeing a positive test after 2 negative tests is nothing to worry about. And the PCR test is not anyway looking for the viable or live viruses. It's only looking for the RNA. So you could have viruses present on the mucosal surface already neutralized by the antibody. Therefore, if it is in the droplets thrown out by speaking or cough, that may not be infectious at all. So the issue of occurrence or persistence is not anything to worry about. Now, most recently, there have been experiments in monkeys, and monkeys seem to behave very much like humans with infection and disease, and only a limited number of monkeys have been tested, but so far, every monkey given the first infection becomes solidly immune against a second infection. So put your minds at rest. Once infected, that person will remain. Well, immunocompromised people cannot respond with strong immunity. Therefore, they are at very high risk of severe disease with the coronavirus infection. The reason for severity increasing with age is that as an aging process continues, you see various changes in your body. Your skin wrinkles, the hair graying. Similarly, the immune system also is getting old, and therefore it is not as smart, agile, quick, or performing at a high level that you need as age advances. That process starts from about 50, 55, and it is at its worst about 80, 85 years of age. Therefore, people who are vulnerable, particularly those who are senior citizens or immunocompromised or on cancer therapy, they must be protected from infection in their own homes, and that is what we call cocooning, enclosing in a protected environment, or reverse quarantine. People should ensure that they do not carry infection and pass it on to such people. So that's a very important question. Now, what about asymptomatic people? That's one question. Fortunately, coronavirus infection, although it is severe in old age and for people with chronic non-communicable diseases, by and large, for people below 50, it is no problem. They do not develop disease very often. In other words, they are infected, but no one knows they are infected. They have no symptom. They don't have any fever, any cough, or breathing difficulty, none at all. So they don't know they are infected. And that is why the infection is spreading rapidly in places like Coimbatore Market, etc. Wherever people crowd, if one person is infected and he doesn't know he's well, he can buy or sell he can talk to people, he can be near somebody else, but he will pass the infection on to the neighbor. So we should therefore think, I should think that everyone in this participants list is infected. So when I come near you, I will not come without a mask. Or if I won't come, if you are also not wearing a mask. Similarly, you must consider me as potentially infected. So when you come near me, you wear a mask and you insist that I wear a mask. That's the only way you can beat the infectiousness in asymptomatic people. The next question is about this virus is mutating according to reports from many virology labs. Will these mutations change the behavior of the virus? Will it change the, if an antiviral drug is developed, will it change the sensitivity to the drug? If a vaccine is made, will the vaccine become non-effective in the mutated virus? These are very, very important questions that we are all concerned with. We are looking for any evidence available. Now, we must realize that it's a very strong theory now emerging among scientists that when the virus shifted from the bat to humans in China, it is very likely, no proof, very likely that it was a very mild infection. It did not kill many people, did not cause severe disease. And by the time it reached the city of Wuhan, it became quite virulent, causing very severe disease and high mortality. That could have been, no proof yet, could have been through mutation. So this is a new virus in humans, and when the virus is adapting to humans by human to human to human transmission, it is possible that the virus became more virulent for human beings. So it does not have to mutate anymore to increase its virulence. It's already highly virulent, especially for senior citizens and for people with any immune deficiency state due to chronic diseases or immunomodulating therapy. So that is a likely result of a possible mutation. So far, in spite of all the mutations, the virus remains to be a single type. So we don't think a vaccine that is made against the virus in UK, or a vaccine made against the virus in USA, or one made in China or South Korea or Italy or Israel will not work elsewhere. So we hope that these vaccines, when they become approved in their own countries, will be fully effective in every other country, including India. That's our hope. I must add that all RNA viruses have very high mutation rate. That is because they don't have proofreading mechanism during virus replication inside the cell. The mutation is too much, the virus will not survive. It's a dead end. If the mutation is minor and it does not affect the virus's subsequent development, then those mutations will survive. But those mutations are, by and large, not affecting the major portion of the virus that we are afraid about, the receptor binding spike protein. So far, not much change has been observed, one study has shown a very minor shift, minor change. I can't use the word shift, but so far that does not mean that the virus has changed. So we have to assume now that the mutations, also they are frequent, will be inconsequential from drug or vaccine point of view. There are some practical questions that have come. When you go buy vegetables or fruits in the market, are not the surfaces likely to be contaminated by someone else or the shopkeeper? So what do you do with them? I have not read up about the details of this, but I have a rule of thumb that I use. I bring vegetables and fruits and keep them aside for about 12 hours. My virology knowledge tells me that all viruses on the surface will be dead by about 6 hours. So I'm doubling the time, 12 hours. But if you do a PCR on the surface, you may still find PCR positive because PCR picks up dead viruses also. So a simple rule of thumb, keep it aside for 12 hours. What you buy in the morning, you can handle in the evening. After you come home, you must hand sanitize. If you are in a hurry, excuse me, and if you want to use the vegetable or fruit straight away, fruits with thick skin like apples, you could dip them in soapy water. You know, you are using soap to wash your hands, same toilet soap made into very thin soap solution, and you dip these for 30 seconds, remove them and wash them. You can do that to grapes, you can do that to apples, you can do that to sapota, mango, but you don't have to do it to bananas, because you keep bananas for 12 hours and then the outside is clean. You don't anyway touch the outside in your mouth, so you peel and eat. So fruits are in that fashion. Papaya also can be gently washed with soap and water, then rinse, and you keep it aside. Vegetables, some of them can be washed in soapy water. 30 seconds is all that it will take to kill the virus. Those vegetables that you cannot handle in soap, I'm sorry, just let me, can you call me 1 hour later? I'm on a Zoom meeting. So vegetables that you cannot wash like that, keep it aside for 12 hours and then you can handle it as normal. Brinjal, katrikai, vandakai. You keep it aside and then after 12-hour quarantine, you take it and wash it as usually and then cut it and you can cook. Dr. Arulalan had asked about the need for a head bath when you come home from outside. Particularly the doctor, any doctor would have a number of visitors, even though you're all wearing masks and the doctor is wearing eye goggles. What about the rest of the body surface? If the virus or the droplet had fallen on your hair, that's not going to infect somebody else because you're not going to touch the hair and then touch your nose. So as long as you don't handle the hair with your own fingers, within a short time, you're safe, you're okay. Hands and fingers carry the virus from surfaces to your most important eyes. Fingers infect eyes far more than mouth or nose. you don't put your finger right inside your nostrils, most of us. We simply, by habit, touch the nose like this or scratch the nose. Those are unlikely to inoculate the virus inside your nostrils. So you can be using your common sense, hand sanitize when you come home, keep your footwear is notorious to carry virus, because wherever someone is infected and the droplets have fallen onto the ground, your footwear will carry them. So respect the footwear, keep it outside and let it overnight, 12 hours, and thereafter you're okay. How do you dispose your face masks? It's a very important question. If you're using cloth masks that you made or you got it made in by the tailor or you bought in a shop, they should be either put in hot water in the evening and wrung and dried so that it's ready for use tomorrow, or you can wash in soap and water and they're ready for tomorrow. You don't dispose it after one day use. The other kind of masks that we say, medical masks or surgical masks, after, if you are wearing for, let's say, you wear it for half an hour when somebody came to the front door, you put it away, then later you used it for half an hour. After about 6 to 8 hours use, you must destroy it. Use scissors and cut them into pieces so that it will never be used by somebody else. Cut it down into pieces and then you can throw it into the garbage. Or you can even burn if it is paper made. If you are using sophisticated, what you call medical mask, that is N95 or its equivalent, you must not use it for more than 4 to 6 hours at a time. Then it should be left out to dry. If you want to reuse after 8 hours, technically it has got to be decontaminated. And that is where ultraviolet rays are useful. Sunlight might also do, but then sunlight is hot, and I do not know whether the filter on N95 will be sensitive to heat or not. So you have to either decontaminate in under UV light. You cannot use microwave to cook it because the filter will be damaged. So yes, you have a problem. Why not wear for more than a few hours? Because in case you yourself are infected and you're wearing a mask, the virus will be concentrated inside the mask. And it is very important that if you again get re-inoculated by your own virus, then the number of virus particles that inoculate you goes up. You are likely to have severe disease. How do you enforce people wearing masks? Remember during the times of HIV, 1986-87, how did people change their behavior? Simply by social mobilization. That is, people were educated as to what the virus is all about, what the disease is all about, how bad the disease is, and how easy it is to protect yourself and your family. The same applies to COVID also. Unfortunately, we have not had that kind of social mobilization by the government. That is a deficiency in our overall antiviral armamentarium. Social mobilization was necessary. It is simple. It has to be given by national leaders, state leaders, and it should be authentic, and it is transparent and fully informative. If you tell a child, 15-year-old boy or a girl or a 12-year-old or even a 10-year-old, look here, my daughter or son, you must wear a mask when you are outside home to protect your parents, your brother and sister, your grandparents from getting infected. You are doing it for not only yourself, but to protect your family. Do you think a child will refuse to wear a mask? And if you say the same thing to the husband, that you're wearing it for protecting your wife and your family, or the wife, you're wearing it to protect your husband and the family, nobody will refuse to wear a mask. If we expect that people will obey orders, somebody is telling you wear a mask, TV announces that it is compulsory. You will buy a mask, put it in your pocket, and feel quite all right not to wear it. You don't know why you are supposed to wear. You are treated like a primary school child. Do as you are told. And the primary school child, when the teacher is out of the classroom, will misbehave. You're only supposed to behave well when the teacher is around. So mask wearing is like that. It's simply obeying an order. It is meaningless. I don't think mask will do anything. So social mobilization is the most important thing to make sure that people wear masks. They must understand that they are wearing masks not only to protect yourself, but others in your family. There is one question about what do you feel about our health minister being voted in as the chairman of the executive committee of the World Health Assembly. Now, World Health Assembly is constituted by all the health ministers of all the member nations of the United Nations bodies like UNICEF, WHO, UN. So the health minister is already one member of the World Health Assembly. The World Health Assembly has an executive committee consisting of about, I think, 25 or 30 members. And JP Nadda, when he was the health minister, was the chairman of that executive committee. And he has been replaced by, or he has been in his position, our present health minister, Harshvardhan, is taken in. It's an honor for India, honor for the government of India, but the executive committee chairman does not have powers not inherent within the chairman's prerogative. The chairman is usually the chairman who manages the executive committee meeting, allows agenda items, and allows discussions. And when majority viewpoint is made, the chairman is bound by the majority opinion. The chairman cannot veto other people's opinion. So it's a ornamental position more than a functionally powerful position. So much for question answers. Let me conclude by saying one more lesson for today. I mentioned that when we started the lockdown, we have less than 600 infected persons. And as the lockdown is being lifted by mid-May, we have more than 1 lakh reported. In other words, it has multiplied by leaps and bounds. Now, the epidemic has been not synchronous. It has been obviously asynchronous in different states, within different states, asynchronous within districts and within cities. And so we have in Tamil Nadu, we have a big problem in Chennai. But we don't have a big problem in Vellore district. We had infection come in, even in Vellore city, but the two places, Saidapet and Kasba, were immediately cordoned off, no entry or exit allowed, and over a period of 2 to 3 weeks, the infection was prevented from widespread transmission to other people. So we are by and large unaffected by the epidemic. Now the lockdown is being lifted. What does that mean? This is the time when we might, most probably we will get infected from either Chennai or from Bangalore or from Andhra Pradesh or from anywhere. So far we have been spared the problem in a major way. So this is now when most people will let their guard down, and that is what will be exploited by the virus. So I'm very worried that the story of crying wolf by the shepherd boy, when there was no wolf, for joke, he cried wolf, wolf, and people came and they didn't see any wolf. So they ran away. Next time when he said wolf, wolf, again people came, there was no wolf. That time when really the wolf came, he cried wolf, wolf, nobody came, nobody believed him. So similarly, as we let our guard down, this is the time I'm worried about infection reaching Vellore. And once it reaches Vellore, we have overcrowded spots within Vellore. I don't want to name them to scare anybody, but if infection falls in one or two of those places, in a matter of weeks, it can be widespread in Vellore city. And if people have not been infected in Vellore city so far, then we are all vulnerable. And that is where the virus will multiply rapidly. So that caution we should all keep in our minds. And with that, let me close my talk and see if Maran has any additional questions or comments. Yes, Maran. I'm on a Zoom meeting. I'm addressing the meeting. Can you call me about half an hour later? Yeah, thank you.
Doctor, few
yes,
questions has come, Doctor.
Yes.
One is asking about how to use the sanitizers. Is it okay
how to use that?
Is it okay to use sanitizers quite often?
Okay. Now, the use of hand sanitizer, it should be alcohol-based sanitizer.
Yes.
Non-alcohol-based sanitizers are available, but their effectiveness is unknown.
Okay.
So I would stick to alcohol-based hand sanitizer. Soap and water is also hand sanitizing, effective hand sanitization. The problem is, I don't like the alcohol-based sanitization on my hand because my skin gets very dry. So after I hand sanitize, 15 minutes later, what I do is I use a hand cream, make my skin soft. Okay, so apply hand sanitization only when you have to touch something that is potentially contaminated. All right? Does that answer the question?
Yes, doctor. There is another question, doctor. If there is no vaccine found yet for the virus, then what is the need for continuous testing? is it not sufficient enough to request those affected to stay at home?
The question is, what about why continuously testing?
Yes.
That is a very good question. The testing has been misleading us, unfortunately. The testing was necessary to spot virus importations by people coming from other countries. If they are infected, they had to be quarantined. Or they had to be quarantined as a rule and then let out by testing negative. One way or the other, we needed the testing to stop the virus in its track by importations and imported virus becoming locally transmitted. Once the local transmission expanded into community-wide community transmission, that kind of testing, its importance was gradually coming down. Unfortunately, the government did not realize that its effectiveness or its contribution, its value had almost disappeared. On the other hand, wise doctors always make a diagnosis based on the signs, symptoms, plus the history of the person, clinical history and clinical features. And we use diagnostic tests to confirm the clinical diagnosis. If we had shifted our strategy from testing to find infected people, with our general success rate only 4%, even now it's only about 4%. Some variations in both Mumbai and Chennai, but by and large, it's about 4%. Each test, the government has to incur an expense of 1,000 rupees approximately. Manpower use, material use, reagents, lab time, it would take about 1,000 rupees. So if you spend 100,000 rupees, you detect 4 people. And the test is not 100% sensitive, you missed another 4 people. So the other 4 people think that they are not infected. They don't go into quarantine. They say, I'm not infected, and so they go and infect other people. So the value of the present testing strategy had disappeared by mid or late March. But we are continuing the same strategy as we started with. There is a second problem. Cost is one problem. We have another problem. And that is, so far, we have identified more than 1 lakh infected people. And many people, media outside the country, they're saying 1.3 billion people, only 1 lakh infected. There's something odd about it. There is something very odd about it. Right. We have tested less than 1% of our population. If you have tested less than 1% and got 1 lakh, what is the actual burden of infection? Is it 10 lakhs or 100 lakhs or 200 lakhs or 300 lakhs? No one will know. So the wrong strategy of testing, not the wrong strategy, continuing the strategy of the testing which was valuable at one time, not shifting strategy, has been quite detrimental to our understanding the problem in India. In every battle, the strategy has to be modified as the enemy behavior is changing. So the ground realities have changed. What we need today is clinical diagnosis and confirmation. So if you had taught doctors how to clinically diagnose and you use the test for confirming, my guess is that we could have had 20, 30, 40, 50% confirmation. And therefore, we would be using the limited resources of PCR testing much more efficiently. And through that, we would have identified far more numbers of infected people. And from them, we could have curtailed further transmission. So that's a good question in terms of testing strategy.
Thank you, Doctor.
Yes.
Another question has come, Doctor. If
Yes.
a person is affected in a home, why not we contain that particular home? Why not we, what we are doing now is we are containing the entire street. The question is whether it's going to create a stigma.
There are two parts of the question. If a person is found infected, is there stigma? I will come to that. What is the first part of the question?
If he is affected, why not we quarantine in a particular home? Why we are containment in the entire street?
Yes, very good question. Such people should be quarantined at home only.
Yes.
They should be quarantined at home unless the home is absolutely impossible to maintain quarantine. Then they should be moved to a quarantine place. Who will know? The local administration will know whose home is unsuitable for quarantine. Since 80% of people will not have any symptoms, the person who was tested for public health purpose and not for symptomatic purpose, such person should be quarantined at home. And other members of the family at home should be trained in protecting themselves from getting infected. In other words, they have to be taught what home quarantine means. And those home quarantine steps are what senior citizens, grandparents must have, and therefore we call that as reverse quarantine. As if the senior citizens were infected, nobody should get infected from them. Similarly, nobody should infect them, so that's called reverse quarantine. Home is the best place for these quarantines. Only if they become symptomatic with breathing difficulty should they be assessed by the doctor and if necessary shifted to a hospital. Therefore, everybody who is in home quarantine must have one number of some medical facility whom they can call and report that I have now today morning onwards breathing difficulty, what do I do? And the medical advice will be, you wait until 2 more hours and let me know how you are. In 2 hours time, he says it is gradually becoming worse. That's immediately medical emergency, admit that person in a suitable hospital. Hello.
Thank you.
Good afternoon,
Yes.
sir. Good afternoon, sir. Is there any implication that the coronavirus infection affects the heart? We heard that, like, the virus enters the lungs and that from where the problem starts there. But is there an implication that it can affect the heart?
Yes, that's a good question. Let me first, I forgot about the stigma. When you have typhoid fever, there is no stigma. When you have a common cold, you have no stigma. When you have flu, there is no stigma. So why should there be a stigma? Because it's a natural infection. Nobody's fault. So there should be no reason for stigma, and social mobilization and public health education should have made sure that people do not misunderstand the infection and its results. That stigma is what resulted in dead bodies being ill-treated, undignified management of dead bodies. I request all of you to Google search with the following words: Quint, Quint, dignity after death. You will get a video. Please watch that video carefully. That will tell you far more about why the stigma has been very bad. Okay, next question. Will this virus affect the heart? You know, I can tell you that we call the disease as pneumonia. The pathology of the lung disease is not like pneumonia. But because lungs are affected, and for want of a different term, we still use the word pneumonia. It is more than pneumonia, different from pneumonia. It prevents oxygenation of the red blood cells. Okay, second point. This virus circulates inside the body and reaches the heart, the kidneys, the brain, and causes severe disease in all of these organs in a minority of patients. People who recover from the lung problem have been known to die of heart stopping. So heart is very seriously affected in severe COVID. Kidneys are affected. So doctors use the diagnosis sepsis syndrome or multi-organ disease. So severe COVID is not only pneumonia, but multi-organ disease. Okay. Hello.
Okay, yes, doctor.
Yes.
Doctor, can you
Yes.
about the death, visiting the death doctor, death people
Pardon?
during this time?
Pardon?
In the funeral.
Tell me again.
Funeral of the corona patients.
Funeral.
Yes, sir. Can we attend?
Yeah. The funeral, let me suggest to you that you go to Google and type Quint. Quint is a medium, a print, web-based medium, Quint. Quint and dignity of dead body or dignity after death, you will get a video link. Please listen to that link. Have you listened to that, Maran?
Yes, doctor.
Isn't that very educative?
Education, yes, doctor. I will subscribe.
Yeah, so,
doctor.
yeah, everyone should listen to that video.
Doctor, the question comes from, is the Kabasura Kudineer will help in
Hydroxychloroquine, is it?
Sir, can I?
Is that hydroxychloroquine?
No, doctor. The Kabasura Kudineer, which government,
Okay,
government is giving to all the
Kudineer,
warriors.
the Siddha. The Siddha. Kudineer.
Yes, doctor.
To be frank, I would say no, it will not help.
Oh.
It will give you false sense of confidence, but it will not help. The thing is, even if that contains an antiviral substance, you need it when you get infected. So before getting infected, you have your Kudineer. Anyway, it goes down your throat. You're getting infected in the nose. It's not going to be helpful. Those of you who know Nasyam or Jala Neti, Ayurvedic nasal cleaning with sodium chloride, you could practice that. Especially if you think that you are in a crowd, you come home and you do your Jala Neti or Nasyam, I would guess that that will work far better than this Kudineer of the Siddha medicine.
Thank you, Doctor. Doctor, another question is from chat room. Is there any natural
Yes.
way of extinction of this coronavirus?
Is there any?
Natural way.
Yes, that's a very good question. This virus is new to mankind, and it is spreading like flu. And what happened with flu was that after it infected all countries and a significant proportion of people in all countries, the epidemics evolved into very low frequency community level transmission. The medical term for it is endemicity. The virus remains in human populations, becomes seasonal, low seasons in summer, high season during monsoon, in temperate climates, high season during winter time. It never dies out. So we cannot expect that this virus will simply die out. You know, every year we have newborn babies. They grow, they have no immunity, and as they grow older, if one child gets infected, that child infects somebody else, and so it will remain in human communities, and I don't think it will ever disappear unless, like polio, we resolve to eradicate it globally. I'm an advocate of eradication of COVID virus, the coronavirus, when vaccine is becoming available.
Yes, Doctor.
Right?
Yes, Doctor. Doctor.
So this virus is going to be with us for a long time.
Doctor. Doctor, this another question has come. Whether
Yes.
this virus spreads through water bodies, Doctor?
Oh yes, you had asked me that question. You know, the best way to prevent infection is well-ventilated halls and rooms. The meaning is that you get your droplet viruses highly diluted, therefore the chance of somebody getting infected is virtually zero. Similarly, if a person with asymptomatic infection swims in the swimming pool, certainly the water gets contaminated, but the virus will be so diluted that someone else getting infected through the nostril is virtually zero. Now, if 10 people are swimming and all of them are infected, and an 11th person jumps into the pool, the likelihood of 11th person getting infected is, by common sense, much higher than if 9 people uninfected are swimming with 1 person infected. So the sheer dilution with the huge amount of water and water being recycled, fluorinated, I don't think that is going to be a medium of infection. All right?
Yes, Doctor. One more. Yeah, Gautam.
Yes.
Yeah, you can ask now. Gautam, are you there?
Yes.
Yeah, you can ask question now. Sir, from Gautam Prajasatesh, his question is whether the virus passes through insects.
No.
Okay.
Simple no.
Yes, Doctor. Fine, Doctor.
Okay. Thank you all very much.
Thank you very much, Doctor. I think
Thank you. Yes.
we cover all the questions which has come from the chat box as well as through our mails and WhatsApp. Thank you so much
Thank you.
for
Have a
spending
nice
your
day.
valuable time and clear all our questions today. I thank all the participants. Special thanks to our secretary, principal, vice principals, and other office bearers and staff members for continuous encouragement and motivation to do webinars. Thank you very much, Doctor. Special thanks to Dr. Arlalan, who is man behind me, I can tell, who is pushing me to get so many questions and put forward to you. Thank you, Doctor, for your
Okay.
questions today.
Okay.
We end up this webinar session today. Thank you,
Bye.
Doctor. Bye, Doctor.
Vanakkam. Nandri vanakkam.
Yes, Doctor. Thank you, participants. With this, I end this webinar session now. Thank you so much. Gautam, thank you. Can we end? Thank you, Doctor.